بسم الله الرحمن الرحيم. هنتكلم النهاردة عن one of the most important fetal wellbeing test, contraction stress test. What's the indication of this test? We need to do this test in a cases of high-risk pregnancy like post-date and post-term, a patient with diabetes, gestational diabetes, in presence of preeclampsia or in presence of PROM, or before induction of labor to show if the fetus can withstand the contraction or not. The technique, how to do this. The patient in a flat position or semi-sitting position, the two probes, one probe to record fetal heart sound here, lower probe, and the other probe above the fundus to record sensor for uterine contraction. And the device will record both uterine contraction and fetal heart rate. Before doing the test, you should ensure that the patient has enough contraction by using intravenous drip of oxytocin to get at least 3 contractions per 10 minutes. Contraindication. The test contraindicated in a cases of preterm labor or high risk for preterm labor because the patient can enter in preterm labor in a cases of pre-prom. If we decide not to do termination, if I decide to do termination for the patient, you can use this test. In a cases of placenta previa and also in the cases of scarred uteruses previous 3 or previous 4 cesarean section. This is the example of the test. The lower chart showing the uterine contraction and the upper chart showing the fetal heart rate. What is the interpretation? We have one of 5 interpretation. Either the test is positive, it means that there is more than 50% of deceleration. What's meant by deceleration? There is no two types of the deceleration, either early deceleration or late deceleration. What's important to me is the late deceleration. Deceleration begin after uterine contraction, not with the uterine contraction. In this graph showing this is the late deceleration. Like if deceleration occur at the time the contraction, this is said early deceleration, and this is normal. Negative, there is no late deceleration. Equivocal suspicious or equivocal hyperstimulatory if there is more than 3 or 5 contraction, or the contraction persists more than 90 seconds. And the last one is unsatisfactory, there is no enough contraction. We show all the result. The first is negative. Negative, here there is no deceleration occur at all, or if deceleration occur at time of contraction, I regard it negative. The second one is positive. We show here the deceleration, the fetal heart rate occur, begin after the peak of the contraction and continue after the end of the contraction, and this means that there is problem, the fetus and termination is needed, and not prefer to do termination by vaginal delivery or by induction. Suspicious contraction stress test. Here I cannot decide what is the problem. There is only one deceleration occur, like in 2 contraction without deceleration. We say that at least 50% deceleration occur, not 1 per 3 contraction. The last one unsatisfactory. I cannot interpret the result here. There is no enough contraction, or the fetal heart rate is not continuous manner because the problem can move. Last one, there is hyperstimulatory one, which is show more than 5 contraction in a 10 minutes. Thanks a lot.